Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician here in Hickory, North Carolina. And today I want to talk to you about what exercises may be appropriate for disc herniations and what might help you. The first thing that I want to tell you is if you have a disc herniation, you have to be evaluated by someone before you begin any type of exercise program. Now, this is in general. This is not specific to you or your case. This is not intended to be medical advice. This is informational. If I knew about your particular case, I might be able to give you very specific recommendations. But let me give you some generalized exercises, or let me give you the most important one that I think helps most people the most. So what you want to consider is the type of injury that you have, first of all. Now, if we know that the disc herniation is, so the disc can herniate different ways. Okay, so we're talking about the spacer between the bones of the spine. There's material in the center that can blow out of the disc and cause compression of the nerves. Now, if that material, what it will do is it can migrate in different directions. Now, if that material herniates straight back towards the spinal cord, then you might be better by doing what we call extension exercises, where you literally lay flat on your stomach and you gently get up on your elbows like you're arching up your back, and you're just resting with your pelvis on the floor, arching up your back. Okay, what that does is, if the material is herniated straight back, it takes the spine like this. This is the back, this is the front, and it creates a wedge. So you see I'm bending it here. So it pinches at the back. So the bones of the spine are like this, you arch your back, and it pinches it together, and that can actually pinch and cause a reduction in that herniation that's going straight back. Now, sometimes you can even come up on your hands, and if you're familiar with any types of yoga poses, you know that's called cobra. Pelvis on the floor, hands flat, and you hold your upper body up and arched back, and you do that for, if it's, a lot of times there's a slight increase in pain for the first few seconds, and then it starts to reduce in pain as that disc herniation is reduced. Now, doing that repeatedly and holding that position can be very helpful. Now, by the way, those are called McKenzie extension exercises for the lumbar spine. So you can Google that if you'd like to see exactly how it's performed. But they're McKenzie exercises of the lumbar spine. And I oftentimes will use those if we have a disc herniation in combination with the therapies that we have. Sometimes we'll even place people on our non-surgical spinal decompression table in that position. It's kind of like, that position is almost like laying in a hammock on your stomach. When you think about it, the hammock's curved, right? So laying on your stomach, it creates the same kind of extended position with the back, and then we apply the decompression therapy, which is incredibly effective for some of these disc herniations. So, that's probably the most beneficial, I would say. These McKenzie extension exercises of the lumbar spine can be very helpful. So again, though, only if you know what you're dealing with, only if that's prescribed by someone. This is just informational. I want to share with you guys what I see that can work and really help people to improve their back. So if you have any questions, if you'd like me to take a look at your case and let you know whether or not I think that we might be able to benefit you with some of the therapeutic approaches that we take in our office, I'd be happy to do so. Just give us a call. Our phone number is 828-324-0800. You can also find out more about us at hickoryspine.com. But if you need anything, I'll be happy to give you my opinion and try to help you out. I look forward to talking to you soon. Hope you have a great day. Thanks.